Welcome to a new edition of System Update. I'm Glenn Greenwald. This episode explores the radical and very abrupt shift in our discourse from media outlets and particularly from public health policy experts surrounding the coronavirus and specifically its relationship to the protest movement that has erupted first in the United States and then around the world in the wake of the murder by the Minneapolis Police Department of George Floyd. And this radical, abrupt shift in how the coronavirus pandemic is discussed has prompted many people to ask, certainly including myself, whether public health experts are abusing their expertise and exploiting their credentials in order to disguise what are their political judgments about the merit of various protests or various activities under the guise of public health judgments in order to dictate which protests and which activities are permissible and which ones are not. And I've made the argument that I think there is at least some, if not a great deal of manipulation of public health expertise that we're seeing in how we're instructed to think about the coronavirus pandemic, not for health objectives, but for political ones. And a leading health expert, Adam Gaffney, objected to the arguments that I was making on social media, and I invited him to remove that discussion to a much more constructive venue, namely this one, and I'm thrilled that he accepted. So very shortly, you're going to hear from Adam Gaffney, who is a critical care doctor and a public health expert. He's also the president of the Physicians for a National Health Program, and he's a pulmonary specialist at Cambridge Health Alliance and the Harvard Medical School. And I think the discussion that he and I have to explore this discussion, this debate that has arisen, ended up being a very illuminating and a very constructive one. But before we get to that, I think it's really important to recall the full context, to take a step back and look at the discourse and how it's evolved over the last 4 to 5 months as the coronavirus pandemic has severely changed all of our lives on this planet. Billions and billions of people who have had their lives significantly altered because we were told that this pandemic is one of the gravest threats the human species has faced since at least 1918. Now, if we go back to February and back to March, that was when the discourse surrounding the pandemic first emerged as a consensus. And what we were told was fairly uniform from public health experts across the United States and then across the West, which was that this pandemic is so contagious and so potentially fatal, and even when it's not fatal, so debilitating to our vital organs and to our organism, that it is crucial, that it is an imperative, a moral imperative and a policy imperative that we adopt very severe measures in order to manage it. Specifically, that we do things like vest extreme power in the hands of our governors and our mayors and our state legislatures to impose lockdowns so that we cannot go outside for any reason except when it's absolutely essential. Businesses were shut down by the millions. Small businesses went bankrupt. Large businesses have struggled. People in the United States have lost their jobs, up to 40 million people. Some people haven't left their homes for many months, and those who are required to leave their homes to do essential work are petrified when they do so because of the messaging that has been imparted to us from public health policy professionals and from our political officials that this pandemic is so severe that those kinds of extreme measures, for as much suffering as they entail, are not just rational, but necessary in order to manage the pandemic. It is, without hyperbole, genuinely difficult to overstate how draconian were the measures adopted in response to this pandemic. Not only did people suffer greatly economically, but we were all cut off from our friends and our family members. Many people whose close family members or whose parents or whose children or whose spouses were in the hospital dying of the coronavirus were barred from being with them or from visiting them in the hospital, causing them to die alone and causing family members to suffer greatly as their loved ones passed away without even being able to visit them. Many people whose loved ones passed away were not even able to attend a funeral or a burial outside in cemeteries because we were told that the coronavirus was so contagious that even going outside for that kind of a ceremony could not be justified. People who did go outside, whether it was to beaches or to parks or just to walk on the street, were often shamed by society, shamed on social media, and the coercive power of the state was frequently invoked in order to punish them through fines or through arrests. We saw lots of videos of the police fining or arresting people simply for the crime of going outside. That's how draconian was our collective response to the pandemic, on the grounds that even going outside for any reason posed such severe and extreme and grave dangers that it could not be permitted.
I am a free man in a free country.
Arrests began almost immediately. 19 people were eventually taken into custody.
There are only a few dozen people. It got heated, though, pretty quickly, and now they're taking away some of the protesters now.
Despite this weekend's demonstration, police say most people in Britain followed social distancing rules. But if the rate of infection in the UK rises again, harsher lockdown restrictions may be reintroduced.
Now, it's worth remembering that while there was a consensus about the necessity of these lockdowns, the belief in them was not universal. There were, from the beginning, people who were arguing, not just in the United States, but in many countries around the world, that the lockdowns were too severe, that the harms caused by the lockdowns would be at least as great, if not greater than, the harms that were generated by the coronavirus itself. And one of the arguments that was made was that if we simply shut down the entire economy, if we usher in not just a recession, but a Great Depression, that too will kill huge numbers of people, and that there was a failure, this argument went, this anti-lockdown, anti-quarantine movement maintained, to weigh not just the harms that come from the coronavirus, but also the harms on the other side of the ledger from things like isolation, quarantine, and particularly economic shutdown. And it is certainly true. There is no denying the fact that things like economic shutdowns and Great Depressions and mass unemployment do, in fact, not just harm the public health, but result in large numbers of deaths. There's simply no denying that. Now, the threat of death, of significant death, from an economic shutdown, from imposing quarantines and lockdowns, was not speculative, nor was it trivial. Quite the contrary, it was well documented and very grave. There was a Reuters article, for example, on April 16, 2020, that bore this headline, quote, "The UN warns economic downturn could kill hundreds of thousands of children in 2020. And what it said was quite alarming. It warned, quote, "Hundreds of thousands of children could die this year due to the global economic downturn sparked by the coronavirus pandemic, and tens of millions more could fall into extreme poverty as a result of the crisis," the United Nations warned on Thursday. An op-ed earlier this week in The Guardian by the African-American left-wing writer Thomas Chatterton Williams made this point very, very powerfully, writing under the headline, quote, "We often accuse the right of distorting science, but the left changed the coronavirus narrative overnight." Williams wrote, quote, "But poverty is also a public health crisis. George Floyd wasn't merely killed for being black. He was also killed for being poor. He died over a counterfeit banknote. Poverty destroys Americans every day by means of confrontations with the law, disease, pollution, violence, and despair. Yet, even as the coronavirus lockdown threw 40 million Americans out of work, including Floyd himself, many progressives accepted this calamity, sometimes with stunning blitheness, as the necessary cost of guarding against COVID-19. He is absolutely right. We saw all kinds of people, oftentimes wealthy or at least middle-class journalists and public health officials with advanced degrees, who had the luxury of staying at home and who had the luxury of continuing to work at home and receive payments for their paycheck, either in full version or some discounted version, demanding that everybody else stay at home, no matter what suffering or restrictions or limitations or harms it was causing them, and were very dismissive of the concerns, often mocking it as something very kind of trite and trivial, like people wanting to go to Applebee's groceries or people wanting to go get a haircut, when in reality, people were very concerned about their livelihoods, about their ability to sustain their families in the wake of a massive shutdown of the economy, the closing of huge numbers of businesses, the loss of tens of millions of jobs. And exactly as Williams writes, it was dismissed away with a blitheness that there was simply no grounds, no space, no room to weigh the harms of the coronavirus versus the harms from everybody staying indoors. That was the formula, the consensus dynamic and framework that was imposed on all of us and reflected in public policy since at least March, if not earlier. Beyond the very severe threat to human life from lockdowns and quarantines and other measures adopted in the name of the pandemic, there were also very serious mental health risks and almost certain inevitable mental health harms from engaging in self-isolation, from removing ourselves from the ability to interact with most of our family, with our friends, with our community, with the activities that had our entire lives formed what it is that we do each day. And we did a show several weeks ago featuring the mental health experts Johan Hari and Andrew Solomon regarding how severe these threats likely were to be, especially with prolonged isolation of people simply staying at home and willingly sacrificing or being forced to sacrifice all of the activities that had long composed their identity and their life. Here's some of what Professor Solomon said about that.
Enormous mental health impacts all around. I think they're worst for people who are self-isolating in real isolation. I know people who are not in relationships, who don't have children, who live alone, and who are stuck in small New York City apartments that they're never allowed to leave for what looks like it might be months on end. In general, I think we have tended as a society to prioritize physical health over mental health. And while I think in this instance the physical health dangers are very real, I think the lack of focus on mental health is equally troubling. There are people who, in this degree of isolation, are going to escalate into depression because, as you said, isolation is a generating factor of depression. Some of those people will commit suicide because people commit suicide in desperate times and under desperate circumstances. That means that effectively we'll have people dying of COVID who don't even have it. They'll be dying because of the circumstances around it and because of this self-imposed isolation.
Yet despite the significant empirical evidence warning of the dangers, not just of the coronavirus, but of the measures being enacted in order to manage it, and despite the numerous experts who were documenting how grave those harms and dangers actually were, people who were making these arguments against lockdowns, against quarantines, were widely scorned. In fact, not only were those arguments not vested with validity by most mainstream outlets, they were rejected out of hand as something that should not even be included in decent discourse. It was deemed immoral to even raise those questions, to engage in a cost-benefit analysis or a utilitarian calculus about what are the dangers of quarantines and lockdowns and prohibitions on people leaving their homes versus the dangers of allowing people to leave their homes and further spreading the virus. People were called selfish, they were called immoral, they were accused of being willing to sacrifice the lives of old people, of killing grandma in order to be able to go outside. There was an NPR segment in April of this year hosted by David Folkenflik in which he warned that major media outlets such as Fox News and other conservative outlets who were encouraging people to go outside, who were insisting that the harms from lockdowns were greater than the harms from allowing people the freedom to go out, even carefully, even outside, even in small numbers, would be very dangerous because it was encouraging people to engage in behavior we had to prevent them from engaging in, namely leaving their homes. The segment included a similar warning from a Harvard graduate student, Asaka Rowe, who specializes in understanding how media messages affect societal behavior, who also warned that any media outlets encouraging people to leave their homes, even implicitly, were acting recklessly or dangerously because they were endangering the public health. This is what he said.
Public health officials say the coronavirus can easily be spread by people packed together, like, say, at a protest. Fox hosts like Sean Hannity, Tucker Carlson, and others have cheered the protests, usually from the safety of their own home studios, yet have done so without explicitly noting the risks involved.
You know, when people listen to these shows, if they hear suggestions from the anchors, then, they'll take those suggestions into account, whether those suggestions are about hand washing or social distancing or, attending public gatherings.
It's worth emphasizing that the people who were condemned for leaving their house were condemned for any reason, not if they went to large gatherings, but even if they just went outside. People who went to the beach but maintained social distancing were condemned and shamed. People who walked their dogs in parks suffered the same treatment and often were fined or were even arrested. People who engaged in any kind of social activity lost their jobs, lost contracts. It was a huge scandal anytime anybody left their home, and it wasn't just for trivial reasons. They were doing it oftentimes for their own mental health or their physical health, or to engage in political protest, including protest against the lockdown measures that as citizens they opposed. And yet all of this was demonized. All of this was condemned. All of this was deemed immoral. One person who became particularly prominent and admired was a lawyer who dressed up as the Grim Reaper to go to beaches, even deserted beaches, where there were only a few people maintaining distances in the sun and outdoors, to warn them that they were essentially bringing the risk of death not only to themselves, but to the society as a whole. A police department in the United Kingdom used drones to produce an incredibly creepy program that shamed people for doing things like going on hikes in nature, or simply going on a car ride to a scenic route in order to breathe and get fresh air and leave their homes. This was deemed unethical. It was deemed the people who did that were deemed to be bad citizens, and they broadcast the drone footage, the video footage of the people doing that, with messaging that anyone who leaves their home was acting unethically and immorally. When the governor of Georgia announced in April that he intended to begin to reopen the state, particularly the suburban and the rural parts of the state, on the grounds that they had managed the coronavirus threat, that their health system was no longer in collapse, and were worried about the harms from an economic shutdown, the governor of Georgia was accused of sacrificing people's lives sociopathically. An article in The Atlantic, for example, from April 29th read, quote, "Georgia's experiment in human sacrifice. The state is about to find out how many people need to lose their lives to shore up the economy." Now, I want to be very clear that I always took the coronavirus very seriously. I was definitely supportive of extreme measures in order to manage it, particularly at the beginning when little was known about it, and when there was a serious danger that health systems could collapse, particularly in parts of the world like here in Brazil where I am, but other parts in the United States such as New York, that simply couldn't manage a huge burst of new cases of a virus that the medical profession knew very little about. And I was supportive of those, even while recognizing that there were real dangers, mental health dangers, as I indicated earlier, that we did a show about, but also civil liberty dangers and political freedom dangers that come from vesting in political officials the ability to order people to remain in their homes and to punish them and fine them and shame them and scorn them if they go out, even if they do so safely. We actually did a prior episode with Edward Snowden and Andre Domis about the dangers to civil liberties and to political liberties from vesting this power in state officials. So the main point, the overarching point of this episode for me is that wherever you fall on the political or ideological spectrum, however you think these competing values should be balanced and navigated and calibrated in a time of what obviously is a true crisis, which is the coronavirus pandemic, I think it is absolutely imperative that we work to ensure that not just ourselves, but our fellow citizens have the ability to question orthodoxies and to ask what the long-term ramifications are, or even the midterm ramifications are of a lot of these measures.
Well, I think this depends on your personal perspective and philosophy as to what the role of government is and where those lines are drawn. For myself, I actually don't think the government should have the mandatory authority to say, look, nobody goes out, you can't leave, you can't do this, that, or the other. But that's also for the point, a part of the reason that I feel that way is that I don't believe it's actually necessary. I believe if the government makes recommendations, and we have the kind of public education that's of a quality that can convince people and persuade them rationally that they should limit the amount of time that they spend outside, that they spend in crowds, that they're in basically zones of potential infection and transmission, they will make the right decisions themselves.
Began shrinking the acceptable number of people that can congregate in one place for obvious reasons. The more people congregated in one place, the easier it is for the disease to spread. You're creating a disease vector. So for very obvious reasons, there's been restrictions on civil liberties and the ability to organize in one place. The problem with that, though, is that, as we've always seen in the past, governments tend to veer towards overreach.
But still, even with those dangers, I took very seriously the warnings of health officials about the gravity of this disease, about the unprecedented dangers that it poses to our way of life, and did something that I never thought that I would do, which was be supportive of things like the right of the state to impose lockdowns and quarantines and to restrict our lives in ways that had been previously unthinkable because of how terrifying this virus was. And I continue to view the coronavirus that way. I personally have observed quarantine even when the state hasn't obligated me to do so, because I believe that the health of myself and my family is truly imperiled by this virus, and that quarantining and isolation, as difficult as it is in every sense of the word, is something that is a rational response given the unknown but serious risk that this pandemic poses. And my view that quarantines and lockdowns and isolation were not only a rational response, but even probably a necessary one, was more or less the consensus. It was shared in almost all mainstream precincts with very few exceptions. Virtually no public health experts or credentialed medical professionals stood up to object to it. Any political leaders like Boris Johnson, the Prime Minister of the United Kingdom, or Donald Trump, the President of the United States, who were resistant to measures of isolation and lockdown, were ultimately bullied and coerced and shamed, reasonably so, with my support, into adopting a much more serious tone about what this pandemic was and the responses that were needed. So essentially, from February until about 14 days ago, there was an overwhelming consensus in the West and in developing countries around the world that this pandemic was so serious that we couldn't really go outside unless it was absolutely necessary, and under all costs had to avoid crowds. We had to maintain social distancing. We had to wear masks and do everything we possibly could to avoid infection. 14 days ago, everything changed with regard to how we think about the coronavirus. Once the protests erupted in the wake of the George Floyd murder in Minneapolis, and we began to see not just small crowds, but massive crowds, hundreds of thousands of people packed one on top of the other, protesting in cities, chanting, yelling, screaming, often coughing when they were tear gassed by the police, congregating in enormous numbers. Not only was there no more shaming about people who are going outside, and not just going outside, but doing so in massive crowds, but oftentimes the very same people who for the last 4 to 5 months, politicians, but also public health experts, who were telling us for 4 months that it was our moral duty, our solemn duty to remain at home, who were insisting that governments take more and more extreme steps to require us to stay at home, to use the coercive power of the state to punish us if we decided that we wanted to leave our homes because our lives were it was a risk worth taking. Those very same people started celebrating these massive gatherings of people, one on top of the other, and oftentimes even going further than just celebrating it, but arguing that it was no longer a moral duty to stay at home, but now a moral duty to go out into these crowds. And many of the people arguing that weren't just politicians, but were health professionals who were insisting that their sudden 180-degree reversal in what they were saying, from stay at home, you must stay at home, to you must leave your house and go join these crowds, was not a political judgment nor an ethical judgment, but they insisted it was an actual health judgment. And what makes that so striking is that nothing has changed when it comes to the coronavirus, to its lethality, to its contagion, and to the inability of the medical profession to treat it, let alone cure it. There's still no treatment, let alone cure or vaccine for this disease. It's just as contagious now as it was several months ago. It's just as lethal as it was back in March and April. It's just as debilitating to our vital organs and to our organism if we do contract it but manage to survive as it has been over the last 4 months. Perhaps illustrating most vividly the complete reversal in the messaging and the ethos within the last 14 days is the fact that the lawyer who became famous for dressing up as the Grim Reaper and going to beaches where there were very few people and people who were distancing quite robustly, now suddenly on his social media account is posting pictures of himself at protests where there's hundreds of thousands of people, more than there were at the beaches that he was warning about, where he's encouraging people to participate and proudly displaying the fact that he himself is. We can see many media accounts talking about the relationship between the coronavirus threat and the protest movements in the wake of George Floyd's murder that make that point very explicitly. An article from just this last Monday in the Los Angeles Times was headlined, quote, "Coronavirus deaths spike in LA County with highest weekend total in over a month." In the last 2 days, it read, Los Angeles County officials announced 81 new coronavirus-related deaths, the highest total reported over a weekend in more than a month. The highest weekend total of deaths was previously reported April 18th to 19th when 105 deaths were announced. Officials also reported 3,000 new cases on Saturday and Sunday. So in some parts of the country, the proverbial curve has been flattened or plateaued, but is still extremely serious in terms of the number of new cases and the number of people who continue to die in the United States in our large cities and also now increasingly in mid-sized cities and suburbs. But in other parts of the country, outside of the metropolitan area, the spike is still increasing. The epidemiological curve has not even reached its plateau as tens of thousands or hundreds of thousands of people pour out into the street in extremely close proximity with the approval and the applause and the encouragement and sometimes the direction of politicians and public health officials. There was a separate article in the New York Times on June 2nd entitled, quote, "Protests draw shoulder-to-shoulder crowds after months of virus isolation." And it read, quote, "Epidemiologists said the protests, meaning the George Floyd protests, would almost certainly lead to more cases of the virus. Large gatherings of people are known to have led to chains of transmission in other settings, and police tactics such as spraying tear gas, which causes people to cough, herding protesters into smaller areas for crowd control, and placing arrested individuals in buses, vans, and holding cells also increase the risk of infection. An aggregate model assembled by researchers at the University of Massachusetts projects that the nation will see between 5,000 to 7,000 deaths from COVID-19 each week over the next month." So what we know is that there is nothing remotely over with this pandemic. It continues to spread in very dangerous ways throughout all of the United States at exactly the same time that people are being encouraged to pour out onto the streets one day after the next in tens of thousands and hundreds of thousands in the name of combating police brutality and racist police abuses. Now, I have been very clear from the very beginning that I not only support the protests, that if anything, I thought a protest movement like this was long overdue. How many more videos can we watch of unarmed, innocent people, disproportionately African Americans, being sociopathically murdered, having their lives drained out of them, extinguished by a police force that almost never suffers any accountability? I support the protest movement. I think the cause is undeniably just, but I also think we need to grapple with why it is that the messaging about the coronavirus has changed so suddenly and so radically in such a short period of time, from one that completely unraveled our lives for months on end that caused millions of people to lose their jobs, that caused businesses to close forever, that caused mental health suffering and separation from people in the most difficult times of their lives when they're losing their loved ones. How did it radically shift from that, a consensus over the course of months, to suddenly the coronavirus barely even being spoken about or spoken of in dismissive terms as something less important and less menacing and less threatening than the pathologies that this protest is designed to combat? And I think it's crucial that we ask ourselves whether or not there has been a manipulation of public health expertise in the name of what in reality are political judgments and political values. What's even more striking about this consensus now, this new consensus that it's fine for everybody to go out onto the streets and protest in huge numbers, that the coronavirus is no reason to stop them from doing so or even to discourage them from doing so, is that there was an awareness just as recently as 2 or 3 weeks ago that unlike the rhetoric, the feel-good rhetoric that emerged at the start of the pandemic, namely that the coronavirus doesn't discriminate, that all people, rich and poor, old and young, black, white, Latino, men and women are all equally vulnerable, that we're going to all unite in our common exposure and vulnerability to this pandemic. The reality, as it turns out, as it always turns out, is much different. People who are poor are far more likely to die, not just in the United States, but around the world, than people who are rich because of the availability of much greater healthcare, much earlier health interventions for people who are wealthy, who have private health insurance or access to private hospitals, than people who are poor and have none of that access. And there's also a disproportionate harm to communities of color. People who are African Americans or Latinos were dying at much greater rates in the United States from the coronavirus, or suffering and being infected at much greater rates, typically because they were forced to go out because of the necessity to work outside the home or because of lack of adequate health care. And there was a recognition that the coronavirus itself had a racial component to it, that Black and Latino people were more vulnerable to it, to dying from it, to being infected, and to suffering from it. And so now to watch the dismissiveness in the name of protecting racial minorities or ethnic minorities is very striking and very odd, and deserves more explanation than it's got, because people are saying essentially this virus that kills Black people and Latinos in greater numbers disproportionately is something that we need to stop caring about, or at least minimize our concern over, in the name of Black Lives Matter, even though it is Black lives and Hispanic lives that were already disproportionately suffering as a result of this pandemic, and that will continue to disproportionately suffer if, in fact, as health experts generally agree is likely to happen, there is a massive spike in coronavirus infections and in coronavirus deaths as a result of these large-scale protest movements that have been taking place for 2 weeks and are likely to continue. And there is, at the very least, a paradox that deserves discussion and debate and explanation in terms of how it should be reconciled. Now, one of two things seems to be necessarily true from this shift in the discourse surrounding the coronavirus, and from the very extreme 4-month-long demand that we all stay at home except when absolutely necessary, to the overnight opposite message that essentially we should all be free, and not just free, but encouraged to go out and gather in massive crowds. One of two things necessarily is true. Either, number one, there is going to be a massive increase in new coronavirus cases and people dying as a result of these protests because they're contracting COVID-19, in which case that means that public health officials are encouraging people to do things that they know will spread this virus further, will make people sick, and will kill them, which seems like a pretty extraordinary thing to watch happen. The other possible outcome, number two, is that there won't be a huge spike in coronavirus cases, that because people are outside, because there's hotter weather, warmer weather, because people are wearing masks, it's actually safe to go outside, even in huge numbers, even with people being one on top of the other, chanting next to each other, screaming and yelling the things that people ought to do and are doing as part of these protests, in which case the last 4 to 5 months of advice from the healthcare community, from health professionals, and from the government that it's absolutely urgent that we submit to extremely draconian lockdowns and quarantines, even if it means watching our jobs disappear, being unemployed, watching our small businesses collapse, watching ourselves be cut off from all of the people we love. It has to mean that reaction was at the very least excessive, if not entirely misguided based on the science. So either we're going to see a huge spike in coronavirus deaths and coronavirus infections as a result of these protest movements, which means that I do think health professionals need to explain how they could possibly encourage something that spreads a deadly virus in the middle of a pandemic further, disproportionately, one that kills Black and Latino and poor people, or we're not going to see that increase in infections and in deaths from the coronavirus, in which case we need an explanation as to why it is that we were told for 4 straight months that we can't go outside for any reason, no matter how careful we're being, no matter what kind of economic and mental health harms and physical harms all of those draconian measures entail. As part of this extreme, often unexplained shift in the discourse, we've been seeing the spectacle of government officials, elected leaders who have spent months condemning protests or any gathering of all types suddenly on a dime shift to cheering for these protests, even oftentimes posting photos of themselves participating in them, even when their national emergencies or states of emergency or health decrees are violated by their own participation in these protests that, because of their size, are still banned by the orders that have been in place long ago, with no explanation as to how those two apparently contradictory positions, this use of state power, can be reconciled. To take just one example of a countless number, and it's probably not even the most egregious one, it's just one that happened to be very visible on social media. We can look at the messaging and the statements and the actions of New Jersey Governor Phil Murphy. On May 6th on Twitter, prior to the George Floyd murder, but as protests around the country were intensifying, protesting against lockdowns, against quarantines on the grounds that they were starting to jeopardize people's livelihood. Not that they were preventing people from going to Applebee's or engaging in trivial activities, but that they were a severe draconian curb on people's individual freedom, and worse, were causing severe economic suffering, which again is also a public health risk and a public health danger that everybody acknowledges. Governor Murphy expressed his opinion about those protests, the ones assembling against his order and the order of other elected officials around the country that impose lockdowns. And he said the following, quote, "We're guided by science, not politics. We're guided by data, not protests. We're guided by public health, not emotion. That's how we meet this moment. That's how we save lives." In other words, it doesn't matter that you're protesting. We don't care about your protest. What we care about is the public health. And while your protests are demanding that we lift our lockdown, we're not going to do it because what we're guided by is public health concerns about not spreading this coronavirus and worsening the pandemic. That was his messaging just a month ago. But then on June 4th, as the protest movement was intensifying in the wake of the George Floyd murder, he went to Twitter, the same exact place where he posted that first message just a month ago, and said exactly the opposite. This is what Governor Murphy wrote. Quote, "Yesterday we had another day of overwhelmingly peaceful protests by countless New Jerseyans no longer willing to sit by and accept systemic racism as part of our national condition, taking to the street peacefully to create a better future for our entire New Jersey family." And you can see multiple tweets throughout the last 10 days from Governor Murphy, not only praising the protests, not only applauding their underlying cause, but encouraging them to continue, and even in some sense suggesting that it's a moral obligation to go and do that which just a month ago he was insisting the public health prohibited by force of the state. What's most amazing is that even as he was posting this praise of the police brutality protest and encouraging what he called thousands and thousands of New Jerseyans to go to the streets in order to advance this cause, he still on his Twitter header has this message, quote, "Flatten the curve, wash your hands, stay at home." Stay at home. That's still his messaging, even as he encourages people to go out into the street, to leave their home, to go join a protest that he approves of, while banning and discouraging and shaming those who join a protest that he disapproves of. That seems like a pretty draconian abuse of state power, to invoke public health to say this protest is prohibited, this protest ought to be discouraged, this protest is immoral, this protest is a moral obligation for citizens to go and participate in. The same week that he posted that prior tweet heralding these protests in New Jersey as being crucial to combating systemic racism, he then, with no attempt to explain, no attempt to reconcile, out of the blue posted this announcement, quote, "Update. I've extended the public health emergency in New Jersey for an additional 30 days. We will continue our path forward while remaining vigilant and prepared to act should there be a new outbreak of COVID-19. So the governor of New Jersey, Governor Murphy, obviously doesn't think that the coronavirus is under control. Quite the contrary. He just renewed for 30 days something very extreme, which is a public health emergency that vests in his own hands very unusual and draconian powers to control the activities of the citizens of New Jersey. But at the same time that he's declaring this a public health emergency and worrying about a new outbreak of COVID-19, presumably from these protests, he's simultaneously encouraging people to go out into the streets in huge numbers, exactly that which a month ago we were all shamed and coerced not to do. And again, I think there needs to be some explanation. Were the measures previously too extreme? In which case there ought to be a reckoning of that. Or are people being too lax now about this pandemic that continues to flourish? Now, it's one thing for politicians to adjust or even completely reverse their messaging as the political winds shift. That's something, for better or worse, we expect politicians to do. They're not very known for being principled. They're typically very craven. They formulate their messaging based on what is most popular, and what was popular a month ago, especially in a blue state like New Jersey, was affirming the need for severe lockdowns and quarantine and shaming people who went outside. And what's politically popular now, especially in a blue state like New Jersey, is depicting these protests as a moral imperative. It's still something that ought to be debated. It's still something that's disturbing given the extreme amounts of power these governors are wielding in the name of a pandemic, but it's something that ought to be expected. What's not to be expected is to watch people who are public health experts, medical professionals, people who are on the faculties of the most prestigious medical schools who help formulate responses to pandemic, who are specialists in infectious diseases, also radically adopt a completely antithetical message to the one that they've been propounding for the last 4 months, because the political winds have shifted, and to do so not by admitting that that's what they're doing, namely formulating a political judgment, but by pretending that they're formulating a public health judgment. And we've seen this over and over from all kinds of prominent epidemiologists, immunologists, people who are experts in public health policy, who for 4 months took the maximalist position when it came to the pandemic, that it's urgent that everybody stay in their homes at all times except when absolutely necessary, and that people ought to either be shamed or punished by the state for violating that, who now have adopted the complete opposite message. Not just that it's up to the individual to decide whether it's a risk they're willing to take, which is, again, something that we haven't heard for the last 4 months when people were demanding to be able to make that right themselves. A lot of them are going much further and saying that it's justified from a moral health, from a public health perspective, or even an imperative from a public health perspective, to go and participate in these massive gatherings, and are invoking their public health credentials, their public health expertise, their medical expertise, in order to issue this dictate. Now, just as is true with the dynamic of politicians radically altering their messaging overnight in order to become more politically palatable, the number of public health officials doing the same is far too high to chronicle all of them. All one can do is examine illustrative examples, and there are many, many vivid ones. The first article that really made this point was one at the very beginning of this month in NPR that was headlined, quote, "Protesting Racism versus Risking COVID-19." And then it quoted in the headline a epidemiologist who said, "I wouldn't weigh these crises separately." And the very first paragraph of the NPR article gave a very good sense of what the argument being advanced was. It read, quote, mass protests that have erupted over police brutality toward black people in America are raising concerns about the risk of spreading the coronavirus. But some health experts, even as they urge caution, said they support the demonstrations because racism also poses a dire health threat. Now, that's something with which I agree completely. Systemic racism kills. We've seen videos of that happening, but there's all kinds of more subtle and insidious ways where that's true. But it was also true and still is true that economic shutdowns and Great Depressions kill people as well. And yet that balancing analysis was declared not just off limits and analytically invalid, but immoral. And yet now it's being propounded as though it's the only moral or ethical way of viewing how to weigh these protests against the coronavirus, Chris. A similar article from the New York Times on June 1st about the protest included this paragraph about people participating in the protest. Quote, Tiffany Rodriguez, an epidemiologist who has rarely left her home since mid-March, said it was often impossible to maintain the recommended 6 feet of distance at the protest she attended in Boston on Sunday. But, quote, understanding that police brutality is a public health epidemic, end quote, she said she felt compelled to go. Now, that's an example of somebody who's doing something, in my view, entirely appropriate. She, as an epidemiologist, is not telling other people that they're duty-bound to participate in these protests. She's saying, I, as a citizen of the United States, am assessing that even though I do believe this pandemic is very dangerous, one that I haven't been willing to risk leaving my house for any cause previously, I now believe there's a cause whose imperative is sufficiently pressing that I conclude that I want to leave my house in order to go support it. That, to me, is completely appropriate. She's exercising her own individual judgment and autonomy as a private citizen to go and make decisions for herself about which activities she's willing to risk exposure to the coronavirus in order to pursue it, and which ones she's not, on a level of autonomy and decision-making that has been denied most people over the course of the last 4 months. But many public health professionals have deviated from that totally valid and acceptable, in my view, posture. They've gone further and said, as a public health official, I am announcing that the much greater harm to the public health comes not from this coronavirus pandemic, from this virus that enters people's lungs and causes people to suffocate in their own pulmonary systems with no treatment and no vaccine or no cure. But I'm saying that the far greater public health, not the political harm, but public health risk comes from racism, and therefore we need to go presumably either combat it or eliminate it or cure it through these protests, even if it means risking more coronavirus infection. One of the most illustrative examples came from Jennifer Nuzzo, who is an epidemiologist and a specialist in global health security policy with the Outbreak Observatory. On Twitter, she wrote on June the 2nd, quote, we should always evaluate the risks and benefits of efforts to control the virus. That was the first sentence. We should always evaluate the risks and benefits of efforts to control the virus, except that was exactly what we weren't allowed to do, what people were not allowed to do for the first 4 months of this epidemic. People who are saying we need to weigh the risk, the real danger of the coronavirus to young people, to people who live in rural areas or suburban areas against the harms that will come to them if we shut down the economy completely. That was declared to be morally grotesque. She then went on to say, quote, in this moment, the public health risks of not protesting to demand an end to systemic racism greatly exceed the harms of the virus. Let's read that again. In this moment, the public health risks of not protesting to demand an end to systemic racism greatly exceed the harms of the virus. She's essentially saying that if you care about public health, a month ago, you should have been urging shutdowns and staying at home at all costs. But now, if you care about the public health, you should be leaving your house, because the far greater danger to the public health isn't from the coronavirus, in her view. It's from racism that these protests are combating. Now, that is a view that I think is entirely reasonable. It may even be a view that I share. But here's my question. How is she qualified, competent as a public health expert to make that assessment? Is she or any other public health expert within the scope of their expertise competent to make that judgment about whether a protest designed to defend civil liberties and agitate against economic shutdowns actually is worth getting exposure to the coronavirus versus whether a protest aimed at racism is worth getting higher exposure to the coronavirus. Is she qualified, or is any other health professional qualified to assess the harms that come from economic shutdown, from remaining isolated in one's home, from being separated from one's family members as they die, versus the harms that come from systemic racism and whatever marginal benefits these protests will bring to that? Those don't sound like health judgments to me. Those sound like political judgments to me, which is fine. We should all be making political judgments, but what we shouldn't have are health professionals pretending that their political judgments, their political values, are in fact ones that they're more capable of making than anybody else by virtue of their expertise in health policy, which is exactly what she's doing and so many of her colleagues are doing. Let's look at another example. One from Dr. Thomas Frieden, who used to be previously the director of the CDC and also the commissioner of the New York City Health Commission. This is what he tweeted on June 2nd, quote, "The threat to COVID control from protesting outside is tiny. Tiny. The threat to COVID control from protesting outside is tiny," he said, "compared to the threat to COVID control created when governments act in ways that lose community trust." Now, let's just stop there for a second. From February until the George Floyd murder, did you hear any respected or mainstream public health official saying that the risk to people from going outside in massive groups and protesting was, quote, tiny? Did you ever hear anybody mocking or dismissing or minimizing as trivial the risk of contracting this virus as long as you're outside, let alone that it was tiny when weighed against the severe harms from economic No, that was exactly what nobody was permitted to express. That was exactly what was demonized as a sociopathic, wanting to kill grandma, wanting to sacrifice people's lives for the sake of economic prosperity. Exactly that balancing act that he is insisting upon the right to make, that he's granting himself license to make, was the same balancing act that was denied to everybody else. And he's invoking a claim that the risk of coronavirus from going outside are tiny, something we never heard for 4 months, in order to do it. He then continues, quote, "People can protest peacefully and work together to stop COVID. Violence harms public health." Is that something you heard for the first 4 months prior to the murder of George Floyd from public health professionals? That you can go combat COVID by working together outside in protest? I didn't hear anything like that. I heard that leaving your house was a gravely irresponsible thing to do, to the point that I internalized and believed it and still do, which is why I continue to observe the quarantine. And again, I'm fully in favor of other people making different assessments based on their risk factors, based on the people with whom they live, based on who they might expose to the virus, based on their comorbidities, based on their analysis of what they can contribute. I'm fully in favor of people having the right to go outside and participate in these anti-racism and police brutality protests. I think these protests are doing great good. What I'm concerned about, deeply concerned about, is the manipulation of health expertise in order to control people's activities for political aims while pretending that it's about the public health. I want to be very clear about one thing, which is my own views of this protest movement and of the necessity and moral imperative of these protests, beginning on the very first day after the murder of George Floyd, as not only protests erupted in Minneapolis, but there were even claims that violence was marring the protests. I went and said repeatedly, beginning on that very first day, that I believe these protests were a societal and moral imperative, even if they included looting and civil disobedience and property damage and violence. In fact, I called the protest, even with violence, long overdue. This was the tweet that I posted on the day after George Floyd was murdered and the protest erupted in Minneapolis, saying, quote, the Minnesota violence is, if anything, very overdue. And I analogized it to people in Palestine who have spent decades suffering repression and who are told that no matter what they do, if they try and engage in nonviolent attempts to free themselves of occupation through boycotts, then they're anti-Semitic. If they engage in violence against occupying troops, then they're terrorists. There's nothing they can do besides meek submission that is deemed acceptable. Meek, impotent submission. And that's how I felt and continue to feel with regard to police violence and police brutality aimed disproportionately at African Americans. We simply can't tolerate it as a society any longer. I fully understand and support the fact that people are marching in the streets in huge numbers. As I said from the very beginning, in the middle of the pandemic, and anything, I think it's overdue. What I don't support and what I do find very troubling is the abuse of state power to restrict people's movements when it comes to certain kinds of activities and protest, and to liberate them to do what they want when it comes to others, and particularly the manipulation of public health expertise in the middle of a pandemic when the credibility of public health officials and experts is more important than ever, to sacrifice it at the altar of political causes and political judgments. We've already seen the public health community take serious blows to their credibility, particularly led by the World Health Organization, which early on in the pandemic told people not to wear masks. And now suddenly masks are obligatory, mandatory, with no real explanation about why that happened. Was it because they knew masks could save lives early on, but didn't want to encourage people to hoard them because they wanted to preserve them for nurses and doctors on the front line, in which case they could have said that or should say that now? Or were they just wrong about the science? They said early on that they weren't sure that asymptomatic transmission is possible. Just this week, the World Health Organization called it, quote, very rare, and then backtracked by saying, actually, it can happen as high as up to 40% of transmissions are from asymptomatic people. They said at the beginning, echoing the Chinese government, that human-to-human transmission of the coronavirus seemed like it wasn't something that was real, or certainly wasn't proven, when in fact it was. There's been a lot of erosion in the credibility of public health officials at exactly the time that it's needed most. And to me, nothing would erode it more and should erode it more than watching them manipulate the public by invoking their expertise for what are really political value judgments that they're no more competent to make than anybody else. Probably the zenith, the most egregious expression of that abuse, came in the form of a now notorious open letter signed by now over 1,300 public health experts, largely ones who are at academic institutions on the faculty of medical schools, or epidemiologists or virologists, or in PhD programs, but also public health officials in the public sector as well, who have essentially said that it is not only permissible for people to decide for themselves whether to go to the protest, but it is a moral imperative for them to do so. And I think it's worth examining several parts of this letter. Initially, the letter was written by infectious disease specialists at the University of Washington, and then began to circulate and began attracting the signature of many more people on faculties around the country, and then public health officials as well. And one of the paragraphs that has drawn the most attention, that certainly captures mine, is one of the first ones, where they say that their view of how to think about the right to protest has completely changed based on which public messaging or which protests we're talking about. So this is what it says, quote, on April 30th, heavily armed and predominantly white protesters entered the state capitol building in Lansing, Michigan, protesting stay-home orders and calls for widespread public masking to prevent the spread of COVID-19. Infectious disease physicians and public health officials publicly condemn these actions and privately mourn the widening rift between leaders in science and a subset of the communities that they serve. That is exactly correct in terms of how the public health community reacted to those protests. As of May 30th, we are witnessing continued demonstrations in response to ongoing pervasive and lethal institutional racism set off by the killings of George Floyd and Breonna Taylor, among many other black lives taken by the police. A public health response to these demonstrations is also warranted, but this message must be wholly different from the response to white protesters resisting stay-home orders. Now, to begin with, it is incredibly reductionist and inaccurate to say that the people who were protesting lockdowns and stay-home orders were all white. There were many people of color participating in those protests, denouncing those stay-home orders as an infringement of their liberty or as a threat to their livelihood. I know here in Brazil, I know countless people of color and working-class people, petrified of these lockdown orders, deeply concerned about whether they're justified because of their inability, the constraints on them to feed their family, to provide their children with education. To call concerns over lockdown orders, sustained lockdown orders, a white protest movement is offensive and inaccurate. But what's even worse is for them to openly acknowledge that their messaging about these various protests as public health officials have to be, in their words, wholly different based on their personal assessment of whether they agree with a protest or not. If you are permitting some protest and encouraging them while denying and barring and shaming others because of the ideological views of public health officials and their agreement or disagreement with the messaging of the protest, that is a form of repression. That is an abuse of their expertise as public health officials. And in this open letter, they're admitting having done exactly that, saying that there should be different public health messaging for different protests, even though the coronavirus spreads in exactly the same way at protests, regardless of what the cause is. What's perhaps most extraordinary about this letter is that it acknowledges that these protests are almost certain to lead to an increase in coronavirus infections and COVID-19 deaths. It acknowledges that it is very difficult to impossible to engage in social distancing or other protective measures at these protests. It acknowledges that these deaths and infections are likely to fall disproportionately on African Americans, the very people that these health experts are saying they're most devoted to protecting. And yet, despite all those acknowledgements, that as health professionals, their judgment is that one essentially is morally obligated to participate in the protest, again, not from a political, but from a public health perspective. The letter says, quote, "As public health advocates, we do not condemn these gatherings as risky for COVID-19 transmission. We support them as vital to the national public health and to the threatened health specifically of Black people in the United States. Protest against systemic racism, which fosters the disproportionate burden of COVID-19 on Black communities and also perpetuates police violence, must be supported." They're saying the protest against systemic racism must be supported, and they then go out of their way to say that the same rationale does not apply to the other protests that they don't regard as important. This is what they conclude, quote, "This should not be confused with the permissive stance on all gatherings, particularly protest against stay-home orders. Those actions not only oppose public health interventions, but are rooted in white nationalism and run contrary to respect for Black lives." They're arrogating into themselves the right to dictate which protests you're permitted to attend and which ones you're not as citizens or political actors, but as health professionals. And they're very open about the fact that the protests that they believe in should be permitted, and the protests that they don't believe in, that they regard as white nationalism, which somehow they include protests by people who are very worried about lockdowns and the effect it's having on their lives and their children's lives and their economic prosperity and their ability to survive, that those protests, it doesn't apply. Now, to me, this is a grotesque distortion of public health policy. So the question becomes, how could a public health policy expert respond? Because not only is that a distortion of public health policy, not only does it erode the credibility of this field that's more important than ever in the middle of a pandemic, it also can mislead in a really reckless and irresponsible way the protesters themselves. If you say the protesters have the right to make decisions for themselves about which protests they go to, whether it's worth it to them to expose themselves to the coronavirus to combat police brutality and racism, I would completely agree. But when you have public health officials minimizing or obscuring what those dangers are, you can actually mislead people in a very dangerous way to believe, as the public health expert that I cited earlier, as this letter suggests, that the risk of transmission is, quote, tiny outdoors as compared to the risk that they're combating, which simply isn't true. The coronavirus is just as dangerous as it always has been. An interview earlier this week with Dr. Anthony Fauci, who is the head of the National Health Institute's Infectious Diseases Agency and has overseen the AIDS epidemic and multiple other infectious diseases, including the SARS outbreak and Ebola, and now is overseeing the coronavirus, was very measured and very apolitical. What he essentially said was, look, it's the right of every American to protest if you believe that's what you want to do, and they obviously have an important cause. But as a health professional, I need to say that the risk of coronavirus transmission and the risk of death from it is not any less or more based on how just the cause is. It's exactly the same. The risk is, the danger is, as it was 2 months ago. This is what he said in this interview.
All right, so let's get right to it. Dr. Fauci, we've seen these protests erupt in the past week over the death in Minneapolis. And so when you see crowds gathering on the streets in D.C. and elsewhere, and especially because police have used tear gas and irritants like that, people are coughing on one another in some cases. When you look at all that and you think about the pandemic, what runs through your mind?
Well, what runs through my mind is what does every time I hear about or see the congregation of large crowds at a time and in an area, a geographic area where clearly there is active infection transmission. It's a perfect setup for further spread of the virus in the sense of creating these blips which might turn into some surges. So I get very concerned, as my colleagues in public health, when they see these kinds of crowds. I mean, obviously, not only are they congregating physically close to each other, but often when they start screaming and demonstrating, which is part of the process of demonstrating. I'm not criticizing that, but I'm saying what it's going to be leading to is the likelihood that you might have situations where you would foster the spread of infection, and that's really of concern.
So you think it is likely, would you say? Is that fair? That because...
Well, you don't want to use the word likely, because then if it doesn't happen, then they say you missed the boat. But there certainly is a risk. I would say that with confidence, that when you have the congregation of crowds, as we've been seeing now, I mean, I'm here in Washington, D.C., and you look at the TV and you see what's going on, particularly in a situation in which there is a lot of confusion and a little bit of chaos, people running back and forth, taking their masks off, being close in proximity. That absolutely poses a risk that there might be spread of infection.
Note that he's not purporting any particular competence to judge which protests are more pressing and which ones aren't, nor is he purporting to say which protests justify exposure to the risk and which ones don't. He's saying that's up to you as a citizen, which is something we didn't hear a lot over the last 4 months, but that you should do it in an informed way, which means realizing that frivolous activities such as going to the pool, going to a public pool, or going to a beach, or going to protests that one doesn't agree with bear exactly the same risk of transmission as these protests over the last 2 weeks. In fact, probably more so, since there's many, many more people. They tend to be confrontational, often violent because of the police largely, and therefore carry a much higher risk. That is what a professional public health expert using their expertise properly ought to be saying. And I think that we all have the right to wonder, why is it that the last 4 months of our lives have been completely turned upside down by being told that we have to remain at home? Our kids' schools have been canceled. Our businesses have gone out of, have closed. Our jobs have disappeared. The economy has suffered. People's mental health has been severely eroded. People who are addicts can't even go to NA or Alcoholics Anonymous meetings. People who had loved ones dying were separated even at the last stage of their life, even while they were being buried, because stay at home was the moral obligation, and now suddenly everything has changed. It doesn't require minimizing the importance and nobility and imperative of these protests against systemic racism and police brutality to wonder whether or not either public health officials were too draconian in their advocated measures previously, or whether they're being too dismissive and too lax now in order to endorse what are very popular movements politically. And at the very least, this has to be a question that we're free to explore with rationality and with the intention to have a full understanding. So this show is devoted to that discussion, and I hope you enjoy my discussion with Dr. Gaffney next. Joining me now to help explore these difficult, complex, but very important questions is Adam Gaffney. He is a critical care physician, a public health researcher. He's a pulmonary specialist at the Cambridge Health Alliance and Harvard Medical School, and president for Physicians for a National Health Plan. So suffice to say, he brings ample expertise and specialized knowledge to help us explore these questions. So just to provide the context for how we came together to talk about this, I had shared some of the concerns I had about what seemed to me to be a pretty abrupt change in the discourse on Twitter, and you had responded essentially with some disagreement about my perspective, and rather than fall prey to the Twitter temptation of squabbling, which is never particularly constructively, instead invited you to come and talk about it in a more constructive venue. And I was delighted when you said you would, and I really appreciate your taking the time to talk to me. Thanks so much.
Oh, thanks for having me. This is great.
Yeah, so let me just begin by asking you, it's a pretty complicated debate, so I'd like to just begin with a kind of what seems to be a pretty straightforward question about the science involved in the discussion we're having about COVID-19 and protests in general and the protests against police brutality in particular. Earlier this week, Dr. Fauci was asked about these protests and what his reaction to them was vis-a-vis the coronavirus, and he said, my reaction is the same as I've had from the very beginning of the pandemic. Whenever I see large groups of people gathering together in public, I'm extremely concerned. He said he thought that there was a good possibility, if not a likelihood, that these protests would lead to increased transmission of the coronavirus and ultimately fatalities, not only because of things the police are doing, like shooting tear gas and putting people in small areas, but also just the nature of protests, of getting excited, chanting, yelling, taking off your mask, being too close to people, that it's almost not necessarily inevitable, but highly likely that it'll lead to a spike of new infections. Just on the science alone, do you agree that these protests are likely to do that?
There's no question that having large groups together will likely result in some new infections. I think there's disagreement about the extent, about what will actually come about as a result of these. No, I mean, there's no disagreement that there are risks in protests like that. I mean, I think what we are really discussing is what are the risks that people, might be willing to take on at this stage in the outbreak. When this started, when this first struck in China, they had a complete lockdown. And they needed to do that to get this under control. And when it hit Italy and Spain, they too followed. And Europe had these lockdowns. And so did we, because of the urgency, because of the need, the necessity of mitigating loss of life. And obviously, that response was very sweeping. It was not particularly surgical. And that was because there was a lot of unknowns and because the first and foremost priority was to get this under control. The reality is, though, Glenn, is that we are in a different place right now. Many parts of the country are opening up in different ways. People are making some choices about what are the kinds of things, what are the kinds of risks that they are willing to take or that are reasonable. And the question then becomes, are we in sort of, and I think the example that's been used a lot is, are we sort of in a abstinence or in a safer sex kind of mode of risk mitigation? And I think the general sense is we're moving more towards a safer sex kind of mentality, philosophy at this stage.
Could you just elaborate on what you mean by that? That seems like just to elaborate a little on that metaphor.
Yeah, and I don't remember who first used it. It's certainly not original, but obviously it goes back to the HIV crisis when, there was originally this push for, abstinence as the only way to sort of fight back against spread of HIV. And there was this idea that actually safer sex was going to be a more sustainable and reasonable approach. So obviously, and that's been with us ever since. So that sort of metaphor has been used for the COVID era too. We cannot sustain a lockdown, a complete lockdown of all social, economic, and political activity indefinitely. It's obviously not possible. And even the biggest proponents of these, dramatic social distancing measures, I don't think ever thought of this as something that was sustainable on a permanent basis. So right now, I think that we are shifting towards thinking about things from a risk mitigation, from a risk management perspective, and thinking about, this from more of the perspective of safer sex, a little less from the perspective of abstinence, to try to mitigate loss of life while still allowing crucial life activities to occur. And so the question is a political protest, a historic political protest, against racism and police violence, does it rise to that level?
And I absolutely want to get to that calculus where we weigh those things. But before we do, as you said, people need to make choices about what risks they're willing to take. And obviously when assessing whether or not one is willing to take the risk of leaving one's house to go to a massive protest where there's tens of thousands or hundreds of thousands of people packed closely together on the street, one needs to know what the risk is, right, of the coronavirus in general, and particularly the risk of going into a protest like that. So you had said, and I think you're absolutely right, that the health policy approach has clearly changed from, say, January and February or March as people have opened up the economy, loosened up, as we pulled back from the brink of, say, a collapse of the health system, which was one of the arguments at the beginning for these draconian lockdowns, was we need to give doctors and the healthcare system and nurses some time to flatten the curve so it's not everybody going at once to the health system causing collapse, which is mostly not happening now in American cities. But separating that question about what is a proper approach from a health policy perspective, has your view of the virus itself in terms of how contagious it is, how lethal it is, how kind of unprecedented it is in the scope of other viruses over the last several decades, or since 1918, has that evolved as well, or do you think it's as dangerous as you thought from the beginning?
So, I mean, I will say up front, I'm not a infectious disease epidemiologist. I am a pulmonary critical care doctor, and I deal with public health issues more in the health policy sphere. I mean, certainly we've learned something since March about this infection specifically. There has been some new data that, for instance, outdoor transmission is, in the scheme of things, lower risk. That masks do matter. That two people having on a mask will reduce the transmission from one to the other, is better than one person, better than neither. So there have been some lessons learned. But I mean, look, the reality is that this was to some extent uncharted terrain, not so much the virus itself, which is new and is novel to mankind, but this specific one. But we're in our uncharted terrain in terms of the kinds of public health measures that have been undertaken. There have never been lockdowns on this scale or scope before. And after, we are going to spend months and years discussing what were the interventions that mattered, what were the ones we could have gotten by without, and God forbid if we have another pandemic like this, we'll be able to respond in a more surgical fashion. We hope. I don't know. There are things I think that we went overboard with, that other people think we went overboard with too. For instance, closing down outdoor spaces like parks. That was probably excessive. I think that's the general, that outdoor spaces and parks were probably a good thing to have open and a good place for people to get out safely. I think that the way some people spoke about, say, the other protests, the open up protests, I may have tweeted that I thought they were being overemphasized given their size, but I wasn't the kind of person who was sort of, snidely dismissing them, or calling them sort of murderous for going outside. But I do think you have a responsibility if you're going to engage in a protest, whether, whatever the cause is, whether it's something I agree with or not. I do think you have a responsibility to take measures to protect yourself and others, like mask wearing and that sort of thing. So, I mean, look, this is complex, and a lot of these questions are empirical questions that we don't quite know the answer to. And again, we had to, I think it was right to take those dramatic steps as this was unfolding, as it was, colliding and careening across the country, particularly in the Northeast and, Boston, where I am, Boston area, New York. These were really serious outbreaks, and no one knew for sure what were the specific targeted shutdowns that would work. So we got lots of things down, and now we're reassessing this from, I think, a more risk management perspective. And these are not easy questions for a policymaker to decide. I mean, I'm happy I didn't have to make a decision that would, balance someone's lives on the one hand and economic obliteration on the other, and the timing. It's not easy. But I think right now the question is, these again are historic protests that I think have the capacity to do enormous good for our future and our society, given the horrible stain of racism and all of its pernicious consequences, health and otherwise. And so I think when that happened, when as we sort of proceeded into a new stage of this outbreak, many epidemiologists public health experts and doctors did say, did either say, I'm not going to oppose this, or even show up themselves.
So let me just, if I could just interject there for a second, because I really think this gets to the meat of the matter. You had said earlier, and I totally agree, that everybody kind of has to make the assessment about, hey, this is a protest movement that has the potential to generate enduring effects, to change our society in what a lot of people, including you and including me, believe is for the better. And that's the kind of risk-benefit assessment we make all the time, both on an individual level and on a collective policy level. Is the risk of raising the speed limit 10 miles per hour and getting faster to places and saving money worth the fatalities? Those are judgments we make all the time. I guess one of the things that has bothered a lot of people, and has bothered me as well, is when it comes to this weighing, I'm interested in your view on what is the proper scope of the expertise of health professionals and health experts, which includes you. In other words, a lot of people were arguing before the outbreak of these protests, before the murder of George Floyd in Minneapolis, that the reason the lockdowns were inadvisable from a policy perspective is because the risk of a depression, of shutting down the economy, of putting 40 million people on the unemployment roll, from a mental health perspective as well, of forcing people to be isolated from their families, even as they were dying, that the harms of all of that were much greater than the harms of the coronavirus. And now other people are saying, I don't agree with that, but I believe that the harms of racism, of systemic racism, are greater than the harms of the increased exposure for the coronavirus from these protests. Is assessing the importance of causes, the protests against the lockdowns on the grounds that it infringes individual liberty, that it causes economic suffering, versus, say, the value of protest against police brutality? Do healthcare professionals such as yourself, or health experts such as yourself, have greater competence and expertise to make those assessments than, say, the ordinary person who lacks that expertise?
So the question is, do we have more capacity to make sort of the utilitarian trade-off questions? I mean, look, at the end of the day, each one of us is an individual. We don't speak for anyone else. I think that I don't know that I am the right person to sort of make that judgment call. At the same time, I'm going to be very forthright and honest about what I think. There's no way I'm going to be able to separate my values from what I write and what I say, and whether or not I show up at a protest or not.
But before you do that, let me just press you on that a little bit, and I absolutely want to hear your perspective. But I think this is critical to the debate or the discussion that has arisen, which is a lot of people, including me, agree with anybody, a pulmonary specialist, an epidemiologist, someone in public health positions for decades, who says, I believe that these protests have such a moral imperative and such a potential for good that I think it's quite reasonable that people are willing to risk exposure to the coronavirus in order to go support them, because the benefits of the protest and the elimination of the harm from systemic racism are so great. So that argument is an argument that I think a lot of people, including me, are hospitable to, even receptive to. I think the problem has come that a lot of public health professionals are expressing that view not as a political judgment, which is what it sounds like to me, but as the judgment that's in the province of health professionals as a health policy judgment.
No, I mean, I think if I was going to make a sort of scientific health policy judgment about the potential risk of a protest, I would sort of assess it similarly, whether the protest was something I agreed with or not. Okay, so if there was a protest I disagreed with the politics of, I wouldn't say this should be banned, this should be canceled, you people, that this is intrinsically more dangerous. Obviously, the politics don't make it less and more dangerous. With the exception of if the politics somehow drive people to behave less socially. If people are refusing to wear masks because that's part of the politics of it, I suppose you can make a medical political connection there. But no, you're right. Obviously, the political orientation of the protesters isn't a factor in the risk of it. So I guess the question is, what is the expectation of public health experts? are they supposed to really just be on the sideline when it comes to something this historic and this important, and sort of, withhold all kind of judgment of the moral value or importance of the moment? And that's certainly one approach to this. It's certainly not, my approach. I think of health and politics and public health and medicine as very intertwined and interrelated. So I've never really separated those out in my own work or my own advocacy. But I agree with you that I think that if you're going to speak purely from a sober scientific perspective, the content of the protest isn't what drives, obviously, the potential risks.
Yeah, I think we have a lot of agreement on everything you just said. One of the things that captured my attention and made me start first paying attention to this was I was starting to become concerned that there was almost like a minimization of the risks of going out to these protests in the name of kind of glorifying the protests from not just a moral and political perspective, but also from a scientific one. And one of the tweets that first began to really bother me was from Tom Frieden, who used to be the head of the CDC as well as the health commissioner for New York City. On June 2nd, he wrote the following, and I'm interested in your assessment or your reaction. He wrote, quote, "The threat to COVID control from protesting outside is tiny compared to the threat to COVID control created when governments act in ways that lose community trust." Do you agree that the threat to COVID control from protesting outside is tiny when compared to the threat from governments acting in ways that cause the community to no longer trust it?
I mean, I think that's the devil is in the details. Look, there's a lot of unknown here. We're going to know, we might know, to what extent this was dangerous. I think the reason why there's unknowns is because of the data I mentioned earlier about outdoor transmission seeming to be much lower, masks seeming to be helpful, et cetera. So I think that there's a lot of unknown in the risk. So I don't know if sort of empirically speaking that will prove to be true or false. I do think, though, that it is likely that many of the actions taken by the police in these protests is going to be the greater factor in producing risk. There was a study this week in the journal Health Affairs that found that in the state of Illinois, up to 15% of all total infections in that state were the result of people cycling in and out of jails. Cook County Jail alone. So jailing, arresting, we know are massive risk factors. I think that for spread. So I think there is some truth that and fairness to say that the biggest risks from this are going to be the confinement, mass arrests, the kettling, the closing off of protesters, and potentially the tear gas use, which obviously causes coughing and sneezing and people taking their masks off. So, I mean, we don't know. We don't know yet for sure what the impact will be, but I think there is some fairness to that at least.
So there's a tweet that you had retweeted by James Hamlin, who is a physician, and he's also a staff writer at The Atlantic covering health policy questions, on June 5th. And he wrote, and with the proviso that you're retweeting it doesn't necessarily mean you fully agree with it, but I'm going to ask you what your view of it is. He said, quote, "The notion that medical experts said to never leave home but now hypocritically endorse mass gatherings is a straw man. Social distancing has always been the message. Civic engagement is as essential gets. The distinction will be even more important come November." Now, I have to say that is, leaving aside whether I agree with that is very, very inconsistent with my perception of what the messaging has been since at least February. You can look at the social media accounts or the official pages of a lot of important elected officials, governors, mayors, and the like, where they still at the top say, stay home. And there were, arrests when people would go do things like go walk their dogs in the park or go to a pretty deserted beach. Even with social distancing, people were being socially shamed, if not punished by the state for not staying at home. Do you agree that the message was never stay at home, or do you think that it was stay at home, but it probably was a little bit excessive. And now we're evolving to a better understanding where not just for protests against police brutality, but all kinds of outdoor activities might be more permissible or reasonable in light of what we know about the pandemic.
Well, two things. I mean, I think we need to separate what the sort of general state message was from governors, okay, and what epidemiologists and public health experts said. Obviously, epidemiologists and public health experts were not a monolithic block, and there was diversity within that community. But I agree with you. The message from many of the governors was exactly what you said. But I think that's an example. This goes back to what I said earlier, which is not everything that was done in the name of the lockdown was right. I think the use of my wife, Natalie Shore, wrote a piece for The Nation about the use of police to sort of crack down on social distancing. Huge mistake, put more people at risk. Sort of carceral solutions to the COVID was never a good idea. There were places that had curfews for COVID. That makes no sense. It's not a nocturnal spread of the virus. Why would you have a curfew for a pandemic? It doesn't really make sense. So I think that it is definitely true that we should interrogate and think about some of those specific policies. I think the concept of sheltering in place was a little extreme. I mean, this, it made it sound like there was, zombies in the street, that if you stepped outside, you'd be eaten. So look, I mean, it's easy for me. I was not in a position to make the calls about what happened. So I'm not, it's easy for me to sort of quarterback it or whatever. But I think there is truth that certain things we went too far with. We should not have involved the cops in ticketing or arresting people for stepping outside. We should not have had curfews. We should have kept open spaces more, parks more open, because that's a safe place for people to go. So, I mean, and that's the reality. And I think we can have those discussions. And at the same time, think about that we're in a different place at this moment. And acknowledging that is not hypocritical. Even if you were the person who sort of felt differently a month ago, it's okay if you see that the evidence has shifted. The last thing I'll say with you, I was never into the shaming thing. I'll be honest. I never thought that was productive, and I tweeted about it a couple times to sort of, people took pictures of people at parks and said, what are these idiots doing? And I think part of where
they're killing grandma, they're super selfish, they don't care about the lives of old people, all of that.
I think a lot of that came from a good place, because I think that people felt helpless and scared, and sort of shaming or tweeting about it was a way to sort of do something actively. So I think it came from a good place, but I don't think the shaming was useful. I don't think, and I won't repeat my other things I said, but I don't think that was helpful or useful.
So let me just ask you, because I think you're making an extremely reasonable case, and kind of a explanation about the trajectory of the discourse and our knowledge about it. But one of the things that does genuinely concern me, genuinely, not pretextually, but genuinely, is the credibility of public health institutions like the World Health Organization and just medical experts in general, because I know just as an individual, certainly as a journalist writing about this, I follow the guidance of people who understand science and medicine in a way that I don't. I want to believe in the credibility of these institutions. There's obviously some missteps that the World Health Organization made, at the very least in terms of going back on messaging, which could just be a byproduct of not understanding a very new and complicated virus from the start and learning more about it and changing messaging. At the first they said don't wear masks, then now it's masks are obligatory. At first there were questions about whether the human-to-human transmission was even possible. Now obviously that's the whole predicate of everything we're talking about. Just this week there was some messaging about whether asymptomatic carriers can transmit the virus except in very rare cases, and they kind of walked that back. Even if it's true that just on the pure merits, the health professional community as a whole hasn't been hypocritical, hasn't changed their message for kind of, corrupted political ends. Can you understand the perception of people who either had to say, stay away from cemeteries, even with social distancing, as their spouses or parents or children were being buried, or who are conservatives who were being told that they can't protest for the causes they believe in, that they're concerned about economic suffering was unjustified, that all of a sudden that there's now a protest that liberal America is excited by and supports, the discourse has completely changed. Even if that's not the reality, do you understand why someone might have that perception?
Okay, so I understand where those perceptions could come from. Let's not also forget, this is going to be a tense political battle, and that there is going to be an effort to sort of weaponize everything that sort of has happened, I think, against the left, which is a separate issue. And there's going to be a lot of unfair arguments made. But in terms of fair concerns, I mean, look, the concern about economic damage was very real. Not only was it real, it is real. And I think that I said a couple times that I think if you're going to support these public health interventions, you have to support, universal health care, Medicare for all, because you can't have a system that's sort of an intervention that's going to result in so many people losing jobs and insurance and not have something to sort of fill in the gaps. I think other people said things similar in terms of needing to combine these public health interventions with a sort of sweeping social welfare expansion. Now, it is true that some countries were able to do these things and not have soaring unemployment, right? So we know that. Now, I understand we don't have that welfare state right now, but it's not as though it was that there was no way to have these interventions without at least mitigating to a much greater extent the economic damage. But to get to your larger point about messaging changing, I mean, look, I can't, there's a lot of bodies here. There's the WHO, there's the CDC, there's every state health agency, and then there's every talking head and every epidemiologist and every person like me who's a combination of a couple different things. And so there's going to be a lot of different takes. There's going to be backtracking. There's going to be lessons learned. And again, this is unprecedented, right? I mean, one of the big bits of data that supported social distancing measures was a study done on what happened in 1918, just to give you a sense of how limited the evidence is. And again, as I said, next pandemic, for better or for worse, we'll have more evidence. People are going to spend the next, 100 years until, trying to figure out where we went wrong, what we could do better. And so it's going to be natural that there's going to be some of that back and forth, and it's not to excuse all of it. And I'm sure there were mistakes made in certain areas, and in other areas, people just learned more, and more and new studies were published. So I don't know how to really answer your question. Is there going to be a loss of trust in the medical profession? I don't know. I think that in a fair world, the mistakes will get criticized, but mistakes that were done for the right reasons will be understood, but I can't, I don't have a crystal ball.
So just as the last question, and it relates to most of what we've been discussing, I found the distinction you drew really interesting. You said, look, I am a physician, I'm a public health expert, but I'm also like other things. I'm also a citizen. I'm also somebody who has political beliefs, and I don't believe that my obligation is to be silent and only pronounce on things within my, narrowly defined range of expertise. And, as a journalist, I have had that debate many times. I think, yes, as a journalist, I need to make sure when I'm doing journalism that I'm very focused on setting forth the facts as they appear, but I'm also a human being and a citizen and a member of a society with a lot of values, and therefore feel free to opine outside of the scope of that. I think the problem comes when people purport that their opinions are to be treated differently with more credibility because of their expertise on the questions that aren't necessarily within the scope of their expertise. And the thing that probably triggered that more than anything was the letter that was signed by first epidemiologists and other virologists at the University of Washington that became an open letter signed by, I think, more than 1,300 people now who are largely on academic institutions who are speaking not as citizens. The reason they're the only people who are allowed to join are health experts is because they're speaking as health experts. And they really went very far in that messaging that I've been asking about in terms of picking and choosing which protests are permissible, which ones aren't, on scientific grounds. This is what they wrote, the parts that I think have gotten the most attention. After talking about the anti-lockdown protests and the reasons that they're against that, and then the other new protests that have arisen, they said, quote, a public health response to these demonstrations, meaning the ones after George Floyd, is also warranted, but this message must be wholly different from the response to white protesters resisting stay-home orders. They then went on to say, protest against systemic racism, must be supported. This should not be confused with a permissive stance on all gatherings, particularly protests against stay-home orders. Those actions not only oppose public health interventions, but are also rooted in white nationalism and run contrary to respect for Black lives. So just two questions about that. Number one, are those assessments, in your view, ones that are within the realm of the competence of health professionals to make? And number two, do you agree with that? Do you agree that there should be different health and scientific policies for different protests?
I think the letter, it is a moral judgment, I think. I don't think, even though it's, as you said, academics and health policy people, they're signing on and in the spirit, I think, of a particular moral outlook on the value of these protests. I don't know if there's a way to, I think that if somebody was, in fact, in the government, if someone was a policymaker, if someone was, the head of the CDC and was making different rules for different protests, I think that would be more problematic. I think that what the essence of this letter is there is a moral and health benefit to come from this, and so those distinctions were drawn. I don't know how much sense it makes to sort of to try to go into that any further than that. I think these are people signing on as individuals. These are not policies. These are moral and sort of health assertions. And I think that's just that's what it is. At the end of the day, it is hard to divorce oneself professionally and from what's happening in this country right now, right? These protests do have the capacity to change the future, to change the present, and the health issues that get raised are real. Yes, it is true. It's not just sort of a rhetorical game to say things like, police violence is a health issue or racism is a health issue. There are enormous gaps in life and death and mortality and every kind of almost diseases across the board between Black and white people. And so, I think more or less what people are saying when they sign on with that sort of letter is I support this as a person, as a professional, and I don't know if there's any way to really separate those entirely.
So one of the essential purpose of this program is to try and take complicated and sometimes emotionally fraught debates out of the social media context where oftentimes very, pointlessly inflammatory discourse is fostered, and to delve out more deeply and in a way that's more thoughtful. And I think you've really helped with this discussion everybody do that. I know you've helped me do it to kind of grapple with these difficult issues because it is a new pandemic. How it affects our lives and interlaps with our lives is very new, as is all these protest movements, but particularly the one after George Floyd. So I think it's really important to think about them freely and in an informed and contemplative way. And I'm really grateful to your help in doing that. Thanks so much for taking the time.
It was a great discussion, and thank you for having me.